Hello and welcome to this lecture Introduction to National Nutrition Programs in India. So, there are some nutrition programs in India which run on a national basis. They run throughout the country and hence they are termed as national nutrition programs. There is nothing like national flag, national anthem, national animal. That way, there is nothing like national program. But since they are run throughout India, irrespective of any state, all the states they follow these programs, and hence they are termed as national nutrition programs in India. As you see, the list which has been displayed are these are the programs which run nationally. Among them, there are some national programs also. They are set up as national programs. So let us see which are the programs which run on national basis. The first one is Integrated Child Development Service Scheme. Is commonly called as ICDS scheme. The second is Midday Meal Program. Third is a Special Nutrition Program. Fourth is a National Nutritional Anemia Prophylaxis Program. Next is National Iodine Deficiency Disorders Control Program. And the next is National Goiter Control Program. Then the again Midday Meal Program has been repeated. Applied Nutrition Program and Akshay Patra Program. These are all programs which have nutrition as a component. So because nutrition is a component, it is a nutrition program, and because it is catered throughout India, throughout the country, they are called National Nutrition Programs of India. So India has implemented comprehensive nutrition programs to address widespread malnutrition throughout the country and to ensure food security for all. So now we take one by one. The first one is Integrated Child Development Scheme. We'll take it. It does not require an exhaustive presentation. For that, we'll have an exhaustive presentation for ICDS. ICDS itself is a big topic, so we'll have an exhaustive presentation later on. But now here, what we need to think, what we need to know about ICDS are under these following three headings: comprehensive services, Anganwadi centers, and targeting malnutrition. So the comprehensive services, it provides what? A package of services that includes supplementary nutrition, preschool non-formal education, immunization, health checkup, and referral services. Now all these services, all these basket of services are provided to children under 6 years of age and pregnant or lactating women, including females, adolescent females. So these are the services. The services again I am telling you, supplementary nutrition. Supplementary nutrition doesn't mean nutrition fully. It just supplements the nutrition. That is 1/3 of calories and half of proteins. 1/3 of calories means 1/3 of the energy, or one part of the 3-day food, or that is one time food, and then half of proteins are provided. Then preschool non-formal education, along with the nutrition, when the kid will not be idle in an Anganwadi center. This ICDS is implemented in an Anganwadi center. So this is a preschool non-formal education where there are no exams, but the kids are taught the basics of education. Then immunization will be carried out by the doctor, and then health checkup, and again this will be carried out either by the Anganwadi worker or by the nurse or by the doctor. And referral services, if anything happens, they are referred to the nearest PHC where the doctor will take care of the kid or pregnant and lactating women. So this commonly operates, ICDS operates through a network of community-based Anganwadi centers that serve as hubs for delivering these essential health and nutritional services. So we should remember the new services that which I told you a little while ago, and what is being displayed in the left hand side of the slide. So these services are provided, or these services are catered to in Anganwadi work centers. Now remember, you have to remember this, that each Anganwadi is spread for a population of 400 to 800 people. So 400 to 800 people. And then what is the target? What's the purpose of ICDS? A key focus of ICDS is to reduce malnutrition and improve the health and development of India's most vulnerable populations. The kids are one of the most vulnerable population. So for them, we need to reduce malnutrition and improve their health. So this is the target of ICDS. So this finishes the ICDS. Now there is something called midday meal scheme that happens in the schools throughout India. So midday meal scheme is a national program in India that provides free lunch on all working days for children in primary and upper primary classes in government and government aided schools. So not in private schools, only in government schools as well as government aided schools. In which schools? Primary and upper primary, or you can call it secondary schools, before secondary schools, not secondary, before secondary, pre-secondary or upper primary school. Generally we call it as middle school. So primary and middle schools. The scheme aims to improve the nutritional status of school age children. So because if you are giving food, the kids will definitely attend. Kids from a poor strata or where poverty is rampant, these people, they attend the school. So what's the aim of midday meal program? One is to improve the nutritional status of the children who are coming to the school. Second is encourage school enrollment. There will be less dropouts. The school, since you are giving food, the kids will not easily leave the school unless it is too much, or unless there are some other factors which are compelling the kids from leaving the school. So it encourages school enrollment and attendance, and it supports children's cognitive development. It supports children's cognitive development. Then the highlights of midday meal program are: it provides hot cooked meals to over 113 million children daily. Hot cooked meals, one of the largest programs in the schools run throughout the world. India holds the honor. So it provides hot cooked food to approximately around 113 million kids in India. So it's a great achievement. Then it serves as a social safety net ensuring a balanced diet for underprivileged students. So underprivileged students means the poverty stricken students. They We don't know what they are getting at home, but the government provides them at least one balanced diet so that they don't go for deficiencies. And then the third one, it focuses on locally sourced nutritious ingredients to support local economies. So food is purchased from local economy, local vendors. So it is a double-edged. Both the balanced diet is also served, as well as the business of the local vendors also flourishes. So this concludes midday meal program. Next is National Health Mission. So National Health Mission is also a part where a part of nutrition is also taken care of. So the comprehensive approach, the NHM, it takes a holistic approach to healthcare. It addresses maternal and child health, communicable and non-communicable disease, and strengthens the public health system. NHM, it aims to provide accessible and affordable healthcare services, especially in rural and underserved areas, through a network of the tertiary healthcare system, that is primary healthcare and community healthcare workers. So through them, NHM aims to provide accessible and affordable healthcare services. So the focus on prevention, the mission emphasizes preventive healthcare, including immunization, disease surveillance, and health education. Why? To promote behaviors that are healthy and also to reduce the burden of the disease. Now, Anemia Mt Bharat, again the nutritional component. Anemia Mt Bharat is a national initiative aimed at reducing the high prevalence of anemia in India. As you know, there is iron deficiency anemia is the commonest anemia, nutritional anemia, which is found in India. So to reduce the incidence of this anemia, all the nutritional anemias, this program is aimed to reduce the nutritional anemias. So that this program is called Anemia Mt Bharat. So it focuses on what? Three things: testing, treating, and tracking, or follow-up, what you call. So you test for anemia, you treat for anemia, and you follow up. You track anemia, whether anemia is cured or is coming up again. So the same things, so testing, treating, and tracking anemia in children, adolescents, and pregnant women. So there are three beneficiaries: the children, the adolescents, especially the females, and pregnant women. So through targeted interventions, how do you do these three things? Testing, treating, and tracking. You target, you intervene in the target groups. What are the target groups? The children, the adolescents, especially females, and the pregnant women. So you have to create an awareness among these groups. So that is the essence of Anemia Mt Bharat. So this program leverages technology, it engages the community, and intersectoral collaboration. So it intersectoral collaboration with the health department, the agricultural department. So in this in the sanitation department, so you need to take care, you need to collaborate with the other departments, so that in agricultural department and horticulture department, they increase the food availability or they increase the productivity. And the health department, it treats the agriculture and horticulture department, they increase the productivity of iron rich foods, whereas The health department takes care in testing, treating, and tracking the anemia affected children, adolescents, especially females, and pregnant women. So this we have the goal which was given at the launch of this program was to achieve anemia free India by 2022. So this needs to be revised in future by the government, but as of now we should remember that India should be free of anemia by 2022. So this was the target. Poshan Abhiyan, there is another program which has improving nutrition, multi-sectoral approach, technology or integration of technology, and engagement of the community. Now how do we do this? Improving nutrition, India's flagship program to improve nutritional outcomes in whom children, adolescents, especially females, pregnant women, and lactating mothers. What happens? Why is it? It focuses on what? Reducing stunting, underweight, and low birth weight. So it covers all the groups involving females. So in kids, it focuses on reducing stunting by giving adequate, proper nutrition. And then in pregnant and lactating women, by giving adequate nutrition, we see to it that low birth weight kids are not born, or the kids which are born are not of low birth weight. So the multi-sectoral approach, again it takes the other departments like the health department, women and child development department, sanitation department, education department. All these are involved in providing Poshan Abhiyan. So for Poshan Abhiyan, this is called multi-sectoral approach. You can call it as intersectoral coordination. Again, these sectors, the education sector, health sector, women and child development sector, the sanitation sector, all these are involved in making this program a success. So technology integration, it leverages digital technology like mobile apps and Aadhaar based beneficiary identification to improve service delivery and real time monitoring. So based on Aadhaar or Aadhaar based mobile apps, that will track the beneficiaries. By tracking the beneficiaries, we come to know the real problem India is facing, the real problem of malnourished people. So the beneficiaries are tracked using their Aadhaar number, and then the food or the nutrients are provided to them through mobile apps, or like through mobile apps we track and we collect the addresses, and directly the nutrition is provided to these vulnerable groups or to these target groups, that is children, adolescents, especially females, and pregnant and lactating women. So community engagement, the program emphasizes community mobilization, behavioral change communication, and capacity building of frontline workers to drive lasting nutrition improvements. So community mobilization, we use the community to spread the awareness, and a behavioral change communication is imparted. Behavioral change wherein how to prevent anemia, the behavior required to prevent anemia, the behavioral change required to prevent anemia is addressed in this community engagement. part of Poshan Abhiyan. Now, National Iodine Deficiency Disorders Control Program. In this, iodine supplementation is given. That is, we distribute iodized salt and iodine supplements to vulnerable population to prevent iodine deficiency disorders. So, the population which is vulnerable for iodine deficiency disorders, for them the targeted intervention is we distribute iodized salt and iodine supplements. And monitoring and evaluation is done by assessing the iodine levels and thyroid function in the population to ensure the program's effectiveness. So if thyroid function increases or the thyroid problems they decrease, it means that the program which is being run by distributing this iodized salt as well as iodine supplements, it is of success. So public awareness is required. The entire program rests on public awareness. You need to educate the public on the importance of iodine for healthy development and the risks of iodine deficiency. So the people are educated regarding what are the dangers of iodine deficiency disorders and how they can be prevented by consuming iodized salt instead of the normal salt and taking iodine supplements. So this can reduce the incidence of iodine deficiency disorders. Next is National Deworming Initiative. So National Deworming Initiative, in this it targets more than 30 crore children to ensure access to safe and effective deworming treatments to improve health and nutrition. A course of mebendazole is given for 3 days. Morning 1 tablet and evening 1 tablet for 3 days is given for all the kids who are studying in the schools. So, and awareness and education, the initiative focuses on raising awareness about worm infections and the benefit of regular deworming among parents, teachers and healthcare providers. So an awareness campaign is run to make the parents, teachers aware regarding the benefits of deworming. Because if, as you know, if deworming is not done, the intestines are infested with intestinal infestations or the worms, and then there will be, in many cases there will be blood deficiency or anemia because of this hookworm infestation. So that even if you are giving proper nutrition, the kids are devoid of proper nutrition because of these worms. So these worms need to be removed. So that is called deworming. So this deworming, the importance is shown to the parents and teachers as well as healthcare providers. School-based approach, in the schools they are given, every student is given a course of mebendazole for 3 days. Mebendazole is given BD or that is 2 times daily for a period of 3 days, so that deworming is achieved. And finally we have this Balwadi, or they are community based preschool centers that provide holistic early childhood development services to children under the age of 6 in India. These centers focus on integrated nutrition, health and education programs to support the physical, cognitive and socio-emotional growth of young children, that is under 6 years of age. So they are given, they are taken care of the nutrition component, health and education programs to support the overall growth of young children less than 6 years. So as you can see, an impressive statistics: 10,000 balwadis, 100,000 caregivers, and 3 million children have been targeted to serve the India's youngest population.